Hi everyone, this is Adam here from the Here to Listen podcast. This is another one of our mini episodes to do with our NCS community awareness sessions, let's say, the sessions, a replacement for the community awareness days that we previously had organised. I'm here with Eymor, who's with Healthwatch Youth specifically. Say hi.
Hello.
Say hi. I had a sort of idea about how to approach the question. So the thing about Healthwatch is it's just sort of a massive organisation. It's like a national thing, and then you've got like local providers, and then you've got like the youth bit, and then you've got specifically what you do. So if you can kind of explain a little bit, maybe including all of those, maybe sort of top down, that'd be really useful. Thanks.
Yeah. So Healthwatch is the main part of it is Healthwatch England, as you said, Adam, and it is a nationwide brand as such, if you want to call it a brand. And Healthwatch England is based in London, and they are what they call themselves is almost the consumer champion, and they champion your voice. So whereas things in health and social care, they listen to you, how your experiences with them, what you think is good, what you think is bad, where there's room for improvement, where there isn't enough. They listen to your voices and they prepare reports, productions, and present them to the government or to the relevant authorities, so be it education authorities, health, NHS, the clinical commissioning groups and things like that. And present them, and quite often those groups, as the NHS and the CCGs, they will commission us to complete pieces of work. So you have Healthwatch England, which is the main body, and then they are split up down into your various regions. So I belong to Healthwatch Central Bedfordshire. Bedford Borough also have a Healthwatch, and Luton also have a Healthwatch. I am Central Bedfordshire because I live in Central Bedfordshire. But that's not to say just because I live in Central Bedfordshire I couldn't go and work for Bedford Borough or Luton. But what we do say with our volunteers is if you want to volunteer with us, you have to either live in Central Bedfordshire or access a service within Central Bedfordshire. So that can be either a school, college, doctors, dentists, some kind of health or social care that was doing within the area. So again, Healthwatch Central Bedfordshire, we have the adult side of things, and we have the youth side of things. So the adults will do very much things like a programme called Just Ask, where they're out in the community. You might see them at supermarkets and they're talking to you and asking you, have you experienced a health and social care setting recently? What was your experience? What feedback would you like to give if you could give? What would you like to tell them about it? What was good about it? What was bad about it? How would you improve it? That sort of side of things. And we often have other agencies there like Carers in Bedfordshire. We have the Diabetes, British Heart Foundation. They often come along to these days to promote. A lot of people are not aware of what services are actually available to them. So 2 years ago now, I was asked to set up the youth side of Healthwatch Central Bedfordshire because the young people, especially aged 13 to 24, they kind of get lost a bit. The example I always will give is if you're aged 13 to 24, you go to a doctor's surgery, and you go to the doctor's surgery and you're sitting in the waiting room. You've got a nice corner with some lovely books and some play toys, Lego bricks, the bigger Lego bricks for children, small children. As a 15, 16-year-old, do you want to go and play with them? No, you don't. So then you've got another corner where you've got all like magazines for what I say grown-ups, women's health, men's health, cars, gardening, House Beautiful and all that. Are they appropriate for a 14, 15-year-old? No. So what's there for this you as a young person? Do you feel valued as a young person? So your voice does get lost in that, and again, transition from being a young person to whereas mum or dad or your carer would make an appointment at the doctor's for you, to you having to make an appointment yourself. You get to the age of 14, 15, 16. Who encourages you to make that? I know so many young people that will not pick up the telephone to make an appointment at the doctor's because they simply have no confidence, they don't know what to do, and they're scared. So it's that sort of side of things. And again, at hospitals, do you get treated as a child or do you get treated as an adult? There doesn't seem to be an in-between at the moment. And it's just about getting young people's voices heard. So I have a team of volunteers, and we meet once a month, and we will talk about stuff that's relevant to them. And it will be things like whether they've been to the doctors recently, whether they've been to the dentist recently, whether they've been to hospital recently, what they think about school. Do they have the school nurse service? What about the school nurse service? And one of our projects that came up about last year was a couple of them had been in first aid emergencies at home. And we were talking about, how did you feel? What happened? Who rang the ambulance? Did they guide you through on the ambulance what you had to do? Their response was that luckily there was an adult there that took control. But had they been there on their own with this casualty, would they have known what to do? Apart from ring 999, everyone knows ring 999. Would they have known what to do? How would they have felt more confident in dealing with that situation? So then we looked at that and said, well, what education do you get in first aid? Basic first aid, not like the full-blown first aid, but basic first aid, CPR, someone bangs their head, that sort of side of thing. I said, well, no, we don't. And this was before, because I understand it's supposed to be on the curriculum come September this year. They was like, no, we don't get anything in school. If anything we get is a PSHE lesson, and a teacher gets out Resus Annie in an assembly, shows them what to do, and that's about it. Well, I don't think that's a great way of learning, because you're not trying it out yourself. So we looked at it and we said, okay, well, maybe we can do something to educate the youngsters of Central Bedfordshire. So we got some funding for an event, and we held a first aid event in May last year, which provided a 3-hour training session for 40 young people within Central Bedfordshire. It was provided by St John's Ambulance. The training qualification it's either 3 or 5 years, so they've gone away with that official qualification. And all of them said, even parents from that day said this is such a great thing, they need to learn this. And especially with youngsters being younger, going out, groups and gangs, and I'm not saying knife crime's prevalent in this area, however, who's to say you're not going to come across something? Not that you may mix with these sorts of people or that sort of situation. Who's to say you might not be just riding past on your bike one day and something's happened? Your actions could make a change. So that's one of the things that we promoted. We've also done a 15 steps program, which allows us to go into places such as Bedford Hospital, Luton Hospital, and do a walk around as such, and look at it from the eyes of a young person, what they think is good especially the children's ward, what they think could be better for young people, to make that it's patient experience and making it better. We don't just always look at the negatives. We will always shout and scream about what we think is fantastic. You get, if some of them have had access to a particular service in their life, and they want to write a blog about it, we will always champion it. So that's the sort. We are the voice of the young person, and I'm completely led by them. They discuss what they want to, and we'll go from there.
Cool. I quite like that there's quite an all-encompassing thing. There sounds like there's a lot of involvement in the community, there's a lot of research, but also that you sort of deliver services as well, which was unexpected. I thought that was mostly about advocacy and encouraging change.
Yeah.
I got a question, sort of a devil's advocate question as well, because I imagine that a lot of the information that you might gather may put pressure on, say, hospitals or GPs, essentially to spend money. I mean, ultimately, it's probably going to come down to that. Yeah. And I wondered about what your approach is with knowing that, but also trying to get changes happen.
Yeah. So if I take the 15 steps program that we did, and we went into Bedford Hospital last October, and we published the report in February, they were actually very on board. And they welcomed, there was a team of 6 of the youngsters that went in, as well as myself. They welcomed them, and it was a fantastic day. It really was. And again, going through that sort of program, part of the 15 steps training program is, when you make recommendations, it is to be realistic. Yes, as with anything, you could ask for all the money in the world and I don't think things would still be perfect. Someone will still find a fault somewhere. but we are realistic in what our recommendations was. So one of the things was that they recommended from as young people was at lunchtime in the children's ward, if you didn't have if you hadn't selected the hot meal for that day, you got given a lunchbox, which a cold lunch, which was sandwiches, crisps, yogurt, fruit, something like that. But that was delivered to you at your bed in a I call them garden centre lunch boxes for children, which is a lovely square box that's got a pretty princess print on it, or a pirate print on it, or jungle themed. So I didn't see it, but one of my youngsters said, you know, if I'm a 15, 16-year-old here, I don't want my lunch delivered in that, really. It just makes me feel like silly. And I don't look at it and think, oh, wow, isn't that lovely? I just think, what a waste of cardboard. And we raised this with the hospital, and they were like, do you know what? We've never actually thought of it like that. And by them delivering it in just a plain paper bag just makes that patient, who is 15, 16-year-old, feel valued as a 15, 16-year-old rather than just assuming they're a child. Because, you know, 14, 15, 16, you're at that sort of age where you're starting to become an adult. And you might want to be treated a bit more like an adult rather than a 6, 7-year-old. So things like that. One of the things they did pick up on was Wi-Fi within the children's and teenagers unit. The Wi-Fi wasn't great, and again, as a teenager, they wanted to be able to access their social media and things like that. Recommendation was to improve the Wi-Fi. So upon discussions with the hospital on that, they said, you know, well, we could provide this where they give accelerated Wi-Fi access, but it costs the hospital to do that on a personal basis. We said, you know, in an ideal world, that would be great, but we realise that's not going to be able to be done. So the hospital then go away and look at, well, how can we make that better, but without implementing too much of a cost? So I know they're looking at it at the moment, or they were before all this kicked off, and they'd come up with some kind of Wi-Fi hubs within the children's ward, which for us is great. Do you know what? It was really quite bad, the Wi-Fi, when we were there. If it just improves it slightly for young people, then great. Other things were the gates to go in and out, the access to go in and out the ward, and the youngsters had some issues with that. But again, that can be, it's not a massive cost. Yes, there will be recommendations that do have cost implications, but they don't expect them to be done. It's just raising that issue and getting them, the establishment, to think, okay, well, in an ideal world, it would be lovely if we could do this, but we can't get that because we haven't got the funds for that. However, what's an alternative that we could maybe do to just try and nearly get there, to make it better than it was for the young people.
And something about the job as well. It sounds like you advocate and you do your research, but you also get to see the changes as well, which surprises me, because I thought it'd be a much more like a wider thing that, you know, you send it all the way up to the NHS sort of top odds, and then that's all, you know, you kind of don't hear it.
Especially our report for Bedford Hospital, we got invited back to go to the trust board meeting to present the report. So myself and 2 of the young volunteers came along. So, you know, you've got the big official people and from the hospital in this room. So it was like, oh my gosh. But they were so welcoming. And they thought the piece of work the young people had done was fantastic. They reinforced that they will do their best to accommodate the recommendations that they'd made. And if they weren't able to do some of them, they would see, as I just said, what alternatives could be provided. They've also invited us back in, well, would be 6 months' time, which unfortunately we can't go at the moment. But again, they've invited us back to show us what they have done so far, and they want to do some future pieces of work with us, which is great. And then also Luton and Dunstable Hospital are like, can you come to us as well, please? Because we really like to progress the young person's experience here at our hospital as well. So it's fantastic.
Nice. You mentioned volunteers that are along with you as well, and that leads me on to another question about imagining NCS participants. We're still going to have plenty, but it'll be more of a sort of digital format. what ideas have you got about how they can be involved? I'd say COVID or not, really. How would they normally get involved, and how do you think they can get involved if there's still lockdowns?
Yeah, you see, we would normally meet once a month and have our meetings there and do our work that way. At the moment, obviously, I've not seen these guys since, I think we had a quick meeting at the beginning of February. Yes, February. And then I haven't seen them since. And I do miss them because they're a great bunch of guys and girls. And it's lovely to see them from different backgrounds and different parts of Central Bedfordshire all coming together. And, initially they were staying in their own little gangs, but it's just, starting to make friends and stuff. So it's lovely. How we've been running since, we have been doing a lot of digital. So we have our social media, which is Twitter and Instagram and Facebook.
Mm-hmm.
I've got 4 of my volunteers at the moment who are running my social media. They have to sign the social media guidelines. And then they have the passwords to our accounts. And all I say to them is just post something twice a week that's relevant to young people. It doesn't have to be COVID related. Like this week, I think is National Dental Week. So I've sent out something this morning to say, here's the official posters coming around from the NHS. Let's do something with this. Think of a good social media post and things like that. So they're being involved that way, creating social media. We've also, I'm encouraged them to write blogs. And we've had some fantastic blogs through, absolutely fantastic. And we will publish 2 blogs a week at the moment. And again, it's about how, it doesn't have to be about how they're coping in COVID. But at the moment, I think because the topic is there in front of their minds, I know they're under a lot of pressure with schoolwork and things like that, and how they are coping with not seeing their family and giving up their hobbies and things like that. And some of the posts, they send them to me and I'm like, wow, this is completely raw. And I'm just, I don't know whether we should publish this or not because it's so impactful and emotional. But I'm like, no, this is their words. And I think people need to hear this. The schools, the authorities, they need to realise the impact this is having on young people. And I have got an idea of when this is all finished that I'm going to collate all the blogs over the time and almost have a COVID yearbook, if that makes sense. That's an idea I've got. Again, that's going to have a cost implication. Whether we can do it or not, I don't know. We also promote, so we got sent an app called Think Ninja, which is about, it's normally an app that's only accessible for those young people who have been referred, i.e. through CAMS or CHUMS or through doctors that need that support emotionally and mentally. But they've opened up the app during this time for everybody, for young people, and it helps cope with anxiety, thoughts, depression, and gives tips, and it's quite a good app. One of our youngsters took it upon herself to write a review on this app, which was fantastic. She did a 2-week review on it, which was fabulous. We submitted it, we shared it, I shared it back to those who sent it to us, those from the CCG. I also then sent it to Helios, who was the actual people that developed this app. So has all the psychologists and everything and wrote the app and put it all together. They got in contact and they thought it was fabulous that they had response from a young person themselves trialing this app. And they were so appreciative. They did a online interview with Valentina that they're going to be using. So it just goes to show our work is reaching out. It is getting back to those who are important, that read it and can make a difference. We can make a difference getting our voices heard, but it's up to the grown-ups in them roles to implicate things. So that was a great opportunity. So we're doing blogs.
I mean, just to jump in there, it sounded like some of the things that young people can get involved in from an NCS point of view. So blogs, content, essentially, definitely. I'm wondering about research, whether they can do research as well. You can sort of almost, direct them to a sort of certain area that you feel might be lacking in research or an understanding from a young people's point of view, things like that.
Definitely. We have an account with Smart Survey. So we love a poll. We love a poll or a survey. If there's a particular area they feel that they want to research and get some real answers, we will always put a survey out, and it's up to you to promote it and share it. and get as many people to come back. We've just recently, again, this was set up before COVID was up. We had a discussion at one of our meetings, and we had different views from the young people about listening to music whilst revising. Some thought they needed it. Some were like, no, it shouldn't be allowed because it's distracting. So we was like, okay, well, what can we do with this? Let's have a look at this. Is this something schools need to think about? So they've set up a poll, they set up a survey poll. I've just closed it literally this morning, and there was 150 odd responses on it, which is fantastic. So I've sent the girls the responses, and I said it's up to you what you do with it, whether how you want to present it, make it pretty, and then I'll discuss that with them then. So we love a poll. I'm really keen to try and get people to do some vlogs.
Yeah.
I think almost like a diary. I've tried to get some of my lot to do them at the moment. They're not massively keen. I might have one coming in the next week or so, I'm told. But I understand it's a confidence thing in front of a camera or whatnot. But vlogs, because I know vlogging is the way forward at the moment, and it does grab attention a bit more. What to talk about on a vlog can be anything. The only thing we say is we're not allowed to be political. Okay. But if it reflects in health and social care, I mean, if someone has had toothache in this whole situation, how's that happened? How have you dealt with that? Because I know dental practices is a real bad experience at the moment.
I'm imagining a possibility as well if say a group of young people from the NCS did something like what we're doing at the moment, but say a Zoom one where they could just have like a recorded conversation, a podcast perhaps, on mental health, or just and maybe could be slightly directed by yourself if they make contact. Some suggestions might be, maybe concluding the conversation with their experiences of mental health services and how they feel that things could be better, or things that maybe worked quite well for them that they can enhance in other areas, perhaps something like that. Most definitely.
And something I've asked the youngsters as well, and that's something that's come about because we have a WhatsApp group, is I noticed that some of them are really stressing about school or college work. Some of them are up 7 days a week till 10 o'clock at night. In my eyes, I don't think that's right. That's not good for mental health. That's not good. So discussing things like that. Well, why is that? What support is there from the teachers for home learning? That sort of side of thing. What they think could be done differently. That sort of side of things, definitely.
One of the things that struck me about the COVID at the moment is the lack of information about the other things, such as how do we bolster our immune systems? What kind of, there doesn't seem to be any advice about that at the moment. I listened to a podcast recently that highlighted this, a Joe Rogan one. He had a lady on there called Dr. Rhonda Patrick, who's a biochemist, I think, and had herself as a scientist had some great advice about, obviously vitamin C is an obvious one.
Yeah.
But there's this argument sometimes that if you put loads of vitamin C in you, like 1,000 milligrams, it only uses a certain amount.
Yeah.
And she countered that argument by saying, yes, that is true, but it also increases your plasma. I don't know what plasma is, but there's plasma within your system that will help combat the diseases. She reeled off a few sort of chemical things as well that are found in various different nutritional supplements or food. So I came out there thinking, why isn't that information being cascaded down to us?
Yeah, and we're very much like this. That information is really important, especially for young people. But it's about how to get it across to young people in the right format that they're going to pay attention to it and get it noticed. Because I know at the moment, with some people, if you even mention COVID, they're like, oh, no more information. They don't want to hear anymore.
Yeah.
So it's just getting things delivered to young people in the right content. And that's it, going back to why I let the young people manage our social media, because I'm not a young person anymore. I think I'm trendy. I think I've got an idea of what they want to see and how to get them listen. But at the end of the day, they're young themselves and they know what's going to grab people's attention. So that's why I get them to manage it. I oversee things to make sure everything is appropriate and things like that. But I do know my volunteers and I do trust them. So things like that. And just, I know we talk about COVID and health and social care. I know what a blog that I have got coming that's been going on for the last, I think she's done it for about 2 weeks now, is one in this time where you get, like you say, you get time to reflect and look on life, and you hear about different experiences and stuff like that. One of my volunteers, she's got a couple of friends that are Muslim, and they're going through Ramadan at the moment, and she's said, oh, you know, I'm gonna give it a go myself. I'm gonna see how I've experienced Ramadan myself. So yeah, she's written a blog for me on Ramadan and her own personal experience and how it's made her feel and things like that. So even things like that where you're experimenting new things. You know, has COVID given you this opportunity to learn a new skill? How's that? Have you learned a new language? I know some people are learning new languages. You know, Emily has gone off and experienced Ramadan for a couple of weeks, and it's lovely because again on our WhatsApp group, it's brought the group together a bit, because we have got a couple that are genuinely doing Ramadan because it's their belief, it's their religion, and they're really interested to know how Emily found it. And Emily's got, from what her learning experience, she's got questions for them. So it's really lovely to see people's experience and knowledge widening as well.
Yeah, and it sounds like you're very open to that from the perspective of the NCS. Like, it's almost like any ideas or any content or any personal experience or any group experience that they can kind of bring to you, that sounds like something that you'd be up for. If they were interested in working with Healthwatch Youth, how would they get in contact? Like, are you happy to be the single point of contact where, you know, I'm thinking about what we put in the comments of the YouTube clip. I'll put them in there, but are you happy for like your own details to be in there, or do you want an organisational?
I would say the best way is to come directly to me. Okay. It's just that I don't want it to get lost anywhere in any other email. So my personal email, there is the website. Have a look at the website. There's all of our stuff that we've been doing on our website. If I look at our social media, there's some really cool stuff on there. The stuff that we've been doing at this time, or stuff we have done as well. All our reports are on the blog. So, and again, anything people are involved with that have things produced, i.e. reports or something produced from it, you will have a hard copy sent to you personally, because I think it's important for you to be able to go to an interview or somewhere and say, you know, I was part of this, I was part of the research team, I was part of the production team, I was part of the designing team, and be able to physically hand over a document to say that was the finished product and I was part of that team. I think
I've had experience of that myself. In my last job working for Youth Action, we did a project at Sandy Youth Club that was similar to what I was saying before about the mental health experiences and the things that they feel need to be changed. And what struck me about you as an organisation was how open you were to that and how collaborative you were. And, you know, they gave us some pointers on what kind of questions to ask so that they can feed back the most essential information and keep it focused. And I've seen the report, you know, this lovely document that was put together as a result. And particularly because I was working with some young people that did struggle with their mental health, that did struggle with a sense of purpose, that didn't really feel connected to the world as much as perhaps others. All of a sudden, they had this massive connection, you know, almost going to sort of a government level is the feeling that they had. The pride, I think, came out hugely from that.
Yes, and you're right there. It is the pride. And I think about 8 of my volunteers are going off in September to university. Which I'm very sad about, because I don't want them to go, because they're cracking individuals, but I wish them the best in life. But hearing their success stories and how much they have shouted about Young Healthwatch and their volunteering time with us, and how they feel that it has enhanced their application and their confidence in the university interview, is lovely. It's lovely to know that, you know, again, yes, their voices have been heard, as in that particular piece of work they might be involved in, but it's also benefiting them in other areas, their own personal life as well, which is fantastic.
And I feel like the young people that I work with, they learn how to do a project about mental health. They could do something like that in their future lives as well. Okay, I'm going to wrap up a little bit now. Thank you very much for your time. And what we'll be doing is putting it on the YouTube, and I'll put all your sort of contact details underneath, so that they can make contact with you. Yes. So as I'm saying to most other people, I hope to see you in person at some point. And there's a sense of like we're doing what we can at the moment, and I'm quite grateful that there are systems like this in place to be able to do alternatives. So thank you very much for your time, Amy, and hopefully see you soon.
Yes, take care.
Bye bye.